With respect to surgery, there's two broad avenues when you have breast cancer. One avenue is breast conservation therapy, which essentially means you do a lumpectomy, which means you take out the tumor with surrounding normal breast tissue. After a lumpectomy, radiation is an essential adjunct. To do lumpectomy alone is not really recommended by any of the oncologists that do this. That avenue allows you to preserve your own breast tissue, but has the downside of having to have radiation. One of the issues with lumpectomy is that roughly a third of the women, if you really look at the data, end up with a contour irregularity of the breast that they're not particularly happy with. So one of the newer fields in plastic surgery, and it's a fancy term, oncoplastic surgery, what that essentially means is you're combining plastic surgical incision patterns to breast oncology procedures. And at the time of the removal of the tumor, you reorient the breast tissue from the inside. And when you close the breast and you have radiation, you don't get that generalized contraction because you've filled the void that was created by removing the tumor. That very easily and very effectively controls the contour of the breast through radiation. It's a superior approach, in my opinion, because once you have the lumpectomy deformity with radiation, if you're unhappy with your breast, there's very few options. There are options such as fat grafting, which entails removing fat from the tummy or the hips and then replacing it into the breast. It can improve contour, but it's not as good as addressing it in the beginning. Other options you have, if you have a contour irregularity, is using a service such as compression management services, which is the sole purveyor of products that I use because of their dedication to the field. What they do is they can make custom forms and custom, essentially implants, for lack of a better word, that can go into the bra and give you excellent symmetry when you're clothed, but don't address the underlying problem. To go back to other options, with your cancer, mastectomy may be required. It happens. It's not the end of the world. It's a very difficult thing for a woman to go through, but there are newer options with respect to mastectomy. One of the things I do in my practice is a modified scar pattern, where I use breast lift or breast reduction incision patterns for the mastectomy and then put a full-size implant in one stage. You're done with surgery and you can move on with your cancer care. What the benefit that to the patient is, the woman now gets to get back to the regular world. She gets back to her life. As I mentioned before, when women get the breast cancer diagnosis, they have a million things they have to do, but the world does not stop for them. The benefit of a single-stage approach is twofold, in my opinion. One, the woman gets the surgery over with in one standing. She gets back to her life, back to her children, back to her job, back to her friends much sooner. You don't have to worry about chemotherapy down the road and when you're going to do a second surgery. And the other benefit is the scar patterns are chosen such that all of the scar is on the lower half of the breast, lower third of the breast in particular. So when the woman looks down, she does not physically look at scar, which visually is a stark reminder of what the woman has had to go through.